Katie, you might want to unmute.
So welcome everyone. Welcome to our webinar on change management. I'm Katie O'Malley. I'm a training coordinator at NCFH. And today I'm very happy to introduce Serene Garcia. She's going to help us as we go through some of this material by giving us really the health center take on change management. So Serene is the Chief Information Officer at Finger Lakes Community Health Center in New York. She joined Finger Lakes in 2002, and she's held many roles. It really has run the gamut of the type of roles that you see in a migrant and community health center, and that really connect to our topic today of change management. She's been a community health worker. She's coordinated a migrant voucher program that was statewide. She's worked in insurance enrollment and administration. And since 2010, she's been working in the telehealth field. So her long experience is really going to help us today. Welcome, Serene. Would you like to say a word or two before we get started?
Sure. Again, like Katie said, I'm Serene, Chief Innovation Officer for Finger Lakes, and I'm happy to be here. I'm looking forward to this conversation we're going to have. Thank you.
Great. All right. And then for those of you who may not be familiar with the National Center for Farmworker Health, NCFH is a private nonprofit organization located outside of Austin in Buda, Texas. And our mission is to improve the health of farm workers and their families by providing trainings and technical assistance and resources. And we just celebrated our 45th anniversary in 2020. We're very proud of being able to serve the 174 migrant and community health centers in our network who provide primary care services to our farm workers and their families. So let's get started. Our learning objectives today are going to be around strategies for managing change in health centers. And so the first thing we want to do is we want to have a definition of change management. And we used a framework that came from the Pan American Health Organization and the World Health Organization. So the definition that we're going to work on is from that framework. And there's also within that framework of our learning, there were 6 categories of change management activities. So they are government and leadership, stakeholder engagement, communication and training, monitoring and evaluation, and workflow analysis and redesign. So we'll go through each of those and we'll talk about strategies and approaches. And then we have several resources to offer today, 2 in particular that have been produced in the last couple of years for this particular topic. All right, so let's just start off with a poll. I think it's fun to just, say what your attitude is towards change, or maybe what your attitude is towards change today. So Sylvia, would you go ahead and launch our poll, and we'll see how everybody's feeling today about change. Embrace change and always excited. It looks. I always like to watch these things. So Sylvia, is that everyone?
Yes, the poll results are on the screen.
Okay. All right. So we've got I embrace change, and I'm always excited for new opportunities is about even with I'm open to change, but may need some time to adjust. And then we have a few that say it depends on the type of change and how it may impact me. That's great. Thank you. All right. So I thought I would start. What I'll do is I'll go through a few slides, and then we'll have Serene give us the health center perspective. So I wanted to start with, the types of influences and forces that are really driving change for health centers right now. So as I offer some of my ideas, I would like for you to share in chat pretty much in your own words, what kind of influences and forces that you see at your health centers as well. And you can just go ahead, if something occurs to you, just go ahead and put it into chat, and I'll check on it in a minute. But first of all, so the mission of health centers is, in my view, a driver for change. The mission for health centers is to improve the health of your patients and to grow your impact really year by year in your service area, right? So that impact might be increasing access to care, especially if you serve migratory and seasonal farm workers. This could take the form of, a new mobile unit, new outreach, things of that nature. All of that requires planning for change. And then there's always the need for new methods or programs to address the social determinants of health. That could be, like a new screening or new ways to educate patients in a culturally and linguistically appropriate way. So the mission itself definitely is a driver for change. Then there's also really the relationship with HRSA, which is the Health Resources and Services Administration. So health centers receive their federal grant funding under the HRSA Health Center program. So requirements under HRSA include every 3 years, you create a community needs assessment. So it means that you're tapping your networks and your relationships to keep a pulse on the changing needs of your service area. And it also requires health center boards to approve a strategic plan every 3 years. So this is going to be, a kind of a mandate to manage your implementation of change. And then the third really big driver in terms of the HRSA Health Center relationship is the quality improvement job that health centers bring on. Health centers advance a quality assurance, quality improvement model that HRSA makes a huge priority for health centers. And that creates, just a lot of demand for very intentional and skilled change management activities. And then the third one is really the changing health center landscape. We know from, our experience in COVID that health centers being really on the front line of public health emergencies is going to drive an amazing amount of change. And health centers have been so critical and are critical right now in trying to close that equity gap in terms of vaccinations and treatments, things of that nature. Well, also during COVID, we really experienced that there was a need for increased services around mental health. And COVID really put a spotlight on the workforce resiliency issue with staff burnout. And, then in addition to that, on an ongoing basis, health centers have to respond to conditions such as changes in fundings, changes in regulations, changes in requirements from payers, and then adverse conditions that come up like staff turnout or provider shortages. So does anybody have any comments on drivers of change? Let me see if I got any takers in mind. What kinds of items are driving change in your health centers? Technology. Thank you, Rebecca. Yeah. Technology is a big customer for change management technique. Yeah. All right. Consumerism. I know there's a lot of works to a lot of companies who are creating pathways for and apps and things of that nature for customers to connect to healthcare. Value-based reimbursement, yeah, payment methods, payment models, yeah. That's great. All right, I will go ahead and move on. I appreciate that. Thank you. So NCFH in the last 2 years decided to start learning about change management and workforce resilience. And during this time, we sought feedback from health centers. And as a result, we produced 2 resources plus this webinar. So the first resource came out in 2022, and it's called 5 Key Strategies to Help Health Centers Protect Against Staff Burnout. And so we'll have the link. The link is in the chat right now, but we will make sure that it's available to you when you receive your materials after this webinar. It's at the Health Center Resource Clearinghouse. And I mentioned that the pandemic refocused attention on mental health services for patients and, very importantly, mental health of employees. And we learned about how health centers did struggle with staff turnover and began focusing on resiliency and mental health support for their workforce. So just to give an overview of this resource, we defined burnout using a definition that's provided by a very well-known, very well-practiced framework called the MASLAC burnout inventory. And then we offered 5 general strategies for protecting employees. So the strategies suggested in this resource included, starting with a company-wide mindset, of wellness and resilience and resiliency solutions that are developed from the at the organizational level, and and then forgive me, the other areas of the strategies in this resource included focusing on sustainable workloads, fixing inefficiencies, and incorporating staff self-care practices and support. So in terms of workforce resiliency, we found that we were recommending these changes that were company-wide, essentially. So that to me brings forth a question that I really want to ask Serene. Health centers they vary in how they develop their strategic objectives. So the minimum requirements for HRSA are centered around, financial objectives and quality improvement, but some include goals for workforce resilience in their strategic planning. And Serene, I was wondering if you could speak to that. Is that a practice at Finger Lakes, or have you heard of other health centers doing that?
Yeah, great. Thank you. So Finger Lakes Community Health is a federally qualified health center. We're in upstate New York, Finger Lakes region, so very rural area, have a lot of ag workers that do not only crop, but dairy. And we are always running across the difficulty of finding staff in our area. And now, as most folks know, more so than before, right? Because there's just such a need for a workforce. So we're always looking at how can we retain the current staff that we have. We have an initiative here at Finger Lakes that we hire from within our communities. We hire from the families that we work with, or people that have been well versed and aware of the patients that we're serving. So we have processes in place to onboard staff. Sometimes they are brand new to the workforce. They're young people coming in. Sometimes this is their first professional career, so getting comfortable with computer systems and a lot of different pieces. So yes, Kitty, there's processes that we're always considering and thinking about how can we get new staff or retain our current staff in the doors, and then once they're here, keeping them and being aware of that the staff burnout and the hardship that there is, particularly because of what we have been going through these past few years, how much it has been amplified, and all of the different approaches to building that work, the work of having that collaboration between our staff, particularly right now when folks are working remotely and maybe feeling isolated, and really being aware as to what kind of an employee are we as an individual. Myself, am I an introvert, an extrovert? Will I do well working in a remote setting where I'm isolated maybe in my own space and not able to interact physically or regularly within other staff members because I don't see them at the water cooler or in the hallway? So having all of that awareness is really key. So part of our strategic work is to have that training, not only for our supervisors and managers, but also for our staff to be able to know what kind of employee are you? What kind of supervisor do you work well with? What kind of environment do you work well in? So all of those pieces do come into play.
Okay, that's great. And if any of you also want to share in the chat, please feel free if you have any kind of workforce resiliency work that goes on or maybe comes out of your organizational objectives, please go ahead and share that in the chat. So the other resource that I mentioned it'll just be getting released. Y'all are the first to receive it. And it is the subject of, our webinar today. So it's called Key Strategies for Effective Change Management in Health Centers. And so obviously this will be available to you within this webinar, but it will be posted at the Health Center Resource Clearinghouse within a few days. All right, and so given those two resources, I want us to maybe keep in mind a little bit in the back of our minds 2 questions. How can effective change management keep health center activities aligned with organizational strategic objectives? In our feedback, we did receive feedback that sometimes it's hard to stay on track with all the things that a health center needs to do. And then how can effective change management have a positive impact on workforce resilience, a positive impact on the employees who are participating in the change activity? So let's get started on the definition of change. I mentioned that this is from Pan American Health Organization and World Health Organization. So it's the framework that we use to guide our understanding for this project. So change management is the practice and the process of supporting people through change with the goal of ensuring that the change is successful in the long term. And then change management helps people to change behaviors and attitudes and work processes. So not just work processes, but behaviors and attitudes and work processes to achieve desired business objectives and outcomes. So my takeaway really from this is that change management is really the people side of change, and that the goal is the success of the initiative, right? And that means also a success with the attitudes and the skills of your employees. So, what is most important, the skills, behaviors, or the process change obviously is going to depend on the situation. For example, your IT department might fix a workaround and everybody's very happy about that and it goes very quickly. They're ready to embrace that workflow. In other instances, the staff will need to reconsider things that they've grown very, very comfortable with, right? And need to change behavior and take a new approach. So the source material for our framework is on this page. It's also where we get 6 key areas of change management that we kind of organized our thoughts with. And so I'm going to go through them pretty quickly and then we'll go through each and every one of them in more detail, but I can summarize them right now. And then we'll go to Serene. So the first one is governance and leadership. So for health centers, this is, what's needed from your board and health center leadership to prepare for change and support change. Stakeholder engagement, that is, who are all the people that are impacted by your change and involved in the change process, and what do they need? Communication, how and when will communication happen through the entire process? What are the key messages, etc.? Training and education. So notice that we distinguish between these 2 types of learning experiences. Sometimes employees need, education early in the process so that, before they do the training on a new procedure, just so they can understand and be ready. Monitoring and analysis, for example, what data is needed to monitor your change processes, your changing processes as you go along. How will the change be evaluated? At what points in the process? And then workflow and redesign. So process and procedure change obviously is a very important part of healthcare and healthcare change management, especially with health technology, as we mentioned in the chat. And so this is around how will this be handled? So Serene, let me hear from you. I've got some questions up on the screen for you so that you can start getting us kind of an understanding of what goes on at Finger Lakes and how you define change management and things of that nature.
Yeah, great. Thank you. So Finger Lakes Community Health has 8 clinical sites scattered throughout the Finger Lakes region. We're at both ends of the border. So, and we have the beautiful lakes around us, and there's no bridge. So we have to drive around the lakes to get to our locations. So when we implement change, it can potentially be difficult to be able to spread to all of our facilities and be able to get going on these changes. So there's a couple of ways that we do that change. But first, to that first question, there's how do we identify change management in our health centers? It really does go back to what is needed. Our CEO, Mary Z, always says that our North Star is our patients, right? Our job is to provide access to care to our community. So how do we do that? What are the barriers that are there? And that becomes our why. Why is it that we're doing this work? And sometimes this why becomes more work for our staff, and then, or it's perceived as more work early on. And then with that comes resistance, because with change, there's different levels. Going to your poll, Katie, right? You were looking at where do we sit in those levels? Are we early adopters and ready to build that change and ready to jump in? Or are we laggers where we're like, let's see how things roll out. Maybe this change will go away and I don't have to deal with it at all. And then there's the folks in between, right? So either way, we need to really identify why is this needed? What's the benefit of having this change done? And then going through all of those 6 processes that you were referring to earlier to make sure that everything is in place so that we can start training and educating our staff to be prepared for this change. So it does take a bit of planning and preparedness and then monitoring as we move along with that change. And the challenges can vary. It could vary between having awareness of the technology and the resources that are going to be used if the change involves technology or workflows and processes. If we're asking our staff to do business differently, what does that look like? And can we make it organizational wide? Can we build it so that the whole culture of the organization changes? For example, for us, when we started embarking in telehealth services, we started working with tertiary care provider specialists, where we traditionally would say to a patient, here you go, Katie, you're being referred to the to have your child be seen by the pediatric neurologist. Here's your date of the appointment and off you go. Now we asked our staff to say, Katie, you're going to have an appointment with a pediatric neurologist. You're going to come back here. We need to fill out your intake paperwork and get all the labs and all the different things to the pediatric neurologist. And we are going to support you during that telehealth visit. So we're asking our staff to do a lot more work. So there's pushback, and I already have my plate full. I have a lot of things to do. I have all these other pieces, right? So why is this? What's the value in that work? By building a process, a new way of doing business, how does that impact our current work or take away things from that the current work? And in the end, it's going to make us more efficient, effective, accessible, all of those different things that we're trying to do to our patients, right? And as we work with our providers to say, providers, we're asking you to do your job differently. We, as an organization, decided that we were going to leverage video conferencing and have meetings via video as well. So it's not just a specific team or specific department or business unit that's making that change. It's everybody in the organization that's going to be doing that process as well, if that is possible to be done. Another example that I have for you is when we first put in kiosks at our front desk. We struggle with having receptionists available at all of our health centers. So we said, let's put in kiosks where our patients can, if they're comfortable with the technology, they can register or check in on the kiosk. And the patients that need help can be able to talk to the person, the receptionist, and address their needs, and then be able to get people in through the registration process, so then the providers can see their patients faster versus waiting for that registration component to get done. There was quite a bit of pushback saying it was going to be too much work, it wasn't going to work. And so we had to keep massaging and really identifying the workflows and working through all those processes, educating, training our staff, having leadership work through all of that with us. And now today, if a kiosk is down, IT is getting all of these tickets because it has become a part of their normal day-to-day work, part of their culture, part of their work that needs to be done, and they can't live without it, kind of deal. But it takes a big push uphill to get these processes to be bought into the organization and really make it a part of the normal day-to-day work. So that being able to have that patience and that support from your leadership and the team really helps build on identifying what's the change that needs to be done, how is it going to be implemented, what are the resources that are going to be needed for that work, and how do we support the staff and our patients to be able to embrace that change and then build it as part of their day-to-day work.
Yeah. And Amy Marcus has said, yes, I agree with Serene with change reaction from employees and reminding them of the benefits for our patients. A positive attitude we put off as supervisors impact employees' reactions.
Yes, that's absolutely true. Because if you have the organization say, we're going to implement this change, and Katie's like, yeah, team, we're going to do this. And I'm like, yeah, can you believe it? They're going to put this change in. Of course, my staff are going to take that same approach and that same thought process. And then if we pass that on to our patients to say, yeah, we have to do this. I don't know if it's really going to work. Patients are going to be skeptical too, right? So I totally agree with that statement that it really does need to be bought in by leadership, by supervisors, by staff, so that patients can also be able to embrace it as well.
Okay. All right, thank you. All right, so let's start in the first area. I'm going to make a few comments in each of these areas, and then we'll have Serene also comment on them. And I want to, encourage you guys to as well. So the first is governance and leadership. So, this is the board of directors and health center leadership who must continually ensure that resources and policies are in place to support the mission, and that staff are prepared to implement a change. And in fact, I ran on to a definition of leadership that was simply defined as preparing people for change. I thought that was food for thought. So both the board and leadership need to set an expectation, from the top, that effective change management techniques will be used in both the large and the small initiatives. So, some of the areas where we received recommendations or found recommendations were in this area where that they can adopt evidence-based models for organizational change. There are many evidence-based models, for change management, for project management, for performance management, and both the research that we did and feedback from health centers supported the idea of using a model or a process, and of course it would be multiple models and processes, really. Two examples that are we have a link to in the resource that came up were the value transformation framework that is offered by the National Association of Community Health Centers. So this is a framework that helps health centers manage multiple projects. And then we also were recommended the Plan, Do, Study, Act cycle. So that is a methodology for testing out and iterating a new process that you're not really ready to commit to. You just run it through a couple of cycles to make sure that it's what you want, and you can operate in short iterations. So boards can approve policy guidelines, standard operating procedures for both small and large change activities. And these can include, defining some broad roles and responsibilities when change initiatives roll out. Very important that leadership and the board understand that they've got to provide resources for change management, project management, things of this nature to mid-level managers. So they're going to need education, they're going to need platforms, they're going to need resources, because they'll have to manage change projects and they're going to have to train and support their staff. NCFH has always recommended that health centers monitor their staff satisfaction. Either, this might be an annual survey or some other way of doing it. And if you're in the habit, you are going to be ready and willing to assess the impact of a change initiative on your staff's capacity, on their well-being, on their resilience. And just also a reminder that boards need to regularly hear updates on change activities, changes going on in the community, and regularly return to their strategic objectives to monitor progress. So Serene, how does your health center work with change management in this area?
Yeah, so for us, when we identify a barrier, a need, that becomes our why. So back to the telehealth example of pediatric neurology, right? We identified that our children were struggling getting to the pediatric neurologist in Rochester for us, which is an hour and a half, and sometimes 45 minutes. So it depends as to what health center they're in. It could be 45 minutes to an hour and a half or an hour and 45 minutes. So, and what we found was that we needed to identify how to provide that access to our patients. We tried having the specialist come into one of our local sites where all of our other staff or patients could bring staff, or excuse me, other staff could bring patients into the one site and provide care. However, the volume wasn't great enough to have something like that. So we embarked in doing telehealth services. So we identified the project, we identified what work needed to be done, and we ensured that our leadership staff or leadership team was aware of being able to provide time and energy, or time and particularly time, because it was going to be our providers that would need to learn how to do this work, meaning that it would be less time seeing patients, right? So there's that revenue component there, and that training and education was key to have this program be successful. So we did embark in the Plan, Do, Study, Act process, but we ensured that we had the buy-in from leadership, from the board, and explained what the service was going to be and why it was important to allow for our clinical teams to carve out time from their regularly patient care activities to build a training and educational component to it. Going to as far as showing our board and our leadership, this is the peripheral, the digital otoscope and stethoscope, and this is what it's going to look like when it's being put inside the child's ear, what the distant provider is going to be able to see, and really going into detail as to the type of work that was going to be done and why our clinical folks needed to have that time for training. And we built our policies. We did an overall telehealth policy for the organization, and then we needed to really build time to build those procedures. And for that, again, we needed the clinical teams at the table to meet with us to say, what is this procedure going to look like? What is it that you need? How can we make this be effective, efficient, and equal to in person as much as possible? So getting the leadership and the board to really buy in and realize that this was going to cost Finger Lakes time and money, because we were going to have lost revenue, because the providers, the clinical folks, were going to be sitting at the table to provide support in building this program.
Thank you. All right, so I'm going to move on to three areas: stakeholder engagement, communication, and training and education. And we received, quite a bit of feedback from health centers. They had plenty to tell us in these three areas. So I want to also encourage you guys to make your comments in chat on these three areas, and then we'll hear from Serene again. So let's start with stakeholder engagement. So when we talk about engaging stakeholders, we want to make sure to suggest that any individuals or groups that are affected by a change initiative should be discovered early in the process and added to the plan. So our health center feedback mentioned inclusivity, really several times, and a lot of the strategies that are on the resource were offered by our health centers. An important one was help your stakeholders understand the why. So when health center staff are aware of the reason for the change and know who's leading the project, it helps them better understand, be on board with the initiative. And also, health center folks aren't just interested in themselves. They need to know how this is going to benefit their work and their patients. So making sure that staff up front have a conversation about the benefit to their patients is really, really important. And also in the research, we received we discovered the recommendation quite often from the literature to use empathy when you're planning a change initiative, and really put oneself in your employee's shoe to imagine the impact on their jobs. Roles and responsibilities are always really important, and having clarity about who's on first and who does what. Employees really want to understand who the project owners are. And then we definitely got the tip to activate change champions. So change champions don't have to be managers or supervisors, or even they don't even have to be team leaders. They're just employees who can really spread the word and really kind of activate, the people around them and help them to become comfortable with changes that are going on. And we did receive a lot of tips from health centers to use change champions, and also to think about the kind of messaging to your change champions that you want to offer. So moving on to communication. So regular and frequent communication from leadership really helps staff feel that their needs matter during a change initiative. And we do recommend, that was also, by the way, communication during COVID was a lot of feedback we got about, well, we almost like reset how we did communication during COVID, because it was so critical. People needed updates and there was so much going on. So we recommend that during a change project or initiative that you have a defined communication plan. Ensure all staff are updated and aware of the steps in the change initiative process. You want to identify all people who are involved in impacting the change and ensure that they have access to the channels that you're going to use, right? And then determine the content and timing of key messages. You may even have key constituencies that are part of your change plan, and they'll get a message around something getting started. So that should all be happening during the planning process. And then we did receive feedback that, all staff emails, all staff meetings, health center newsletters, all manner of communication channels were used to keep staff informed, and help staff understand, that we're staying on track or not, and things of that nature. So the next one is training and education. So, with training and education, you got to stop and remember sometimes that the purpose is to help employees with the burden of adopting new skills and new attitudes, right? So time for scheduling trainings is often difficult in health centers. So you want to carefully think about what your employees need and when they need it, and be open to a mixture of learning opportunities sometimes, depending upon the change. I mean, that might be infographics, in a workroom, or self-paced courses, or, short in-person sessions, or team huddles, or quarterly training sessions, Again, like with communication, it's useful to have a training plan and make sure that it includes all the people that it needs to include. And then you want to evaluate whether this particular change needs an educational session earlier in the process before you start training in particular skills or processes, things of that nature. And it's so that employees won't be operating with, kind of a lack of domain knowledge, if you will, before they launch into participation with your change initiative. And then you want to remember that you want to ensure that staff have time to integrate the skills and the behaviors and start demonstrating and confirming their understanding and putting these things into practice. You want to make sure before you're running out to measure things that they've really, really internalized it, really integrated their learnings, and that you're ready to roll. So if any of you have any comments, I'll hand it over to Serene on these two issues, but make sure that you share comments and ask questions of Serene, if you will.
Great. So for us, the first thing with engaging our stakeholders, just like you said, Katie, right there are people in our health centers that are natural leaders. They don't necessarily have a authority by a title or a license or anything like that, right? They just naturally are able to lead the troops. So knowing who your folks are is very, very helpful in that, to keep folks engaged. And also being able to be aware of who are your resistors, or maybe people that need just a little bit more hand holding and might need to have that seed planted and let them know that this change is coming, and massaging the idea with them so that they don't get blindsided. And I learned about myself that I love to implement change, but particularly because I like to be aware as to what's happening and be very well versed as to what is taking place and why. When I get blindsided as to a change happening, I have all these questions and some resistance, and thinking, okay, is this going to work? Have all the things been thought out? Have we really looked at this effectively and well enough to know that this is going to function? Particularly because I want to make sure that I'm successful in the work that I do, right? So I take that same thought process and think that folks that are kind of sitting back and saying, is this going to work? Or potentially doing the same thing, right? They don't know the history. They may not be aware. They may not know all of the intricate details behind it, or all the hard work that was done behind closed doors, right? So that communication component is so important. So really want to engage your key players to make sure that they're aware and have that buy-in in there, but then also ensure that the communication is going out and knowing who the audience is, right? Because depending on the audience, you might need to just make it simple, just let them know the main components that they need to know. If you go deep into the weeds of things, they might get lost, it might cause confusion. For example, if someone we're talking to the audience about how to use a platform, they just want to know which buttons they need to push, what is it that they need to do to be able to be successful. If we start talking about how these buttons work and what was built in the background to make it happen, they're going to potentially get frustrated and say, wait a minute, I'm lost. Why are you teaching me this? I don't understand, right? So keeping it simple is very important, and really knowing who is it that we're talking to, what is it that they need to know, do they need to go into a deeper level and understand the background behind it? If so, what level do they need to know about it so that they have that buy-in and component to it? So it is important to really know who the audience is. And then, like Katie, like you were saying, is really looking at your organization and say, where do we touch our staff? At our all staff meetings, at our one-on-ones, at our department meetings. We have to make sure that we're always talking about this new initiative that's coming forward, because people are in their world, right? So even though it's one organization, a community health worker is focused on her work. A receptionist is working on his component of it. And even though we may talk about this initiative once or twice, it's only talked about then. And if you're not talking about it regularly, the staff can easily put it off to the side of the back burner or forget about it and say, wait, what happened? When did we decide to do this? Even though we had talked about it before. So talking about it regularly really keeps watering that seed, I call it, and making sure that staff are aware that this is coming. These are some just nuggets of information that are taking place. Even doing vlogs, just quick video clips to say, this is what it's going to look like, or this is what it's going to do, is going to help with having that staff be aware of what's coming. Or the patient, right? If you're doing a change for patients, that is helpful too. And for the training and the education component, not only doing quick vlogs and emails and talking about it, but also being able to meet the learner's needs, whether they are auditory, visual, kinesthetic, whatever component of their learning. We have all these different components in there. So we'll do videos to show, like, this is how it's done. We have written out tutorials, we have picture tutorials, and we have lab time as well, where you're able to come in with the super users and either know how to use whether it's the platform or the peripherals or the different tools that are being needed for the work. And then we have mock visits. So we go from the moment that this is identified that needs to be done, all the way to the completion of the visit being done. So I have been a patient for a variety of these different components, right? And we go through the whole thing to make sure that the EMR system functions are correct, that the patients are able to get through the system, and the providers and the teams that are all involved are able to get through that process. So we do mock visits that are everything goes well. Oh, the technology fails. Who do we call? Oh, the patient has become irate or they passed out, emergency situation. What's the worst case scenario that could happen? And make sure that everybody involved knows what numbers to call, knows how to connect, knows what needs to be done, so that everybody's ready to go when we go live. And then when we go live, we have people on site. So the staff don't think, okay, now I'm live, but where's my help? If something happens, who do I call? We have people on site to be able to say, okay, if you need me, I'm here. We don't interact. We don't jump in and do the work for them, but we're there to remind them and say, okay, well, what do you need to do now? What is the next step? We coach them through the process and remind them of the different steps that need to be taken. And then we assess, did this process work? How's it going? Does it make sense? Like Katie was saying, we do surveys with everybody involved, whether it's the providers, the staff, the support staff, the patients. Is this effective? Does it make sense? Are we getting the results that we want to get out of this work? And then we go back and reevaluate and make tweaks where it needs to be done before we implement it at another site.
That sounds amazing. That's so interesting. It sounds like there's a lot of support for your employees as well. Does anybody have any questions for Serene or any comments at this point before I move on?
And Katie, while folks are typing in the chat there, even with all of this said though, do not be surprised if somebody calls you and says, I don't remember how to do this, or can you show me again how to do this? Or what are you talking about? This is all new to me. I've never been trained. Even though we have competencies written out, we say, well, here's the signature stream. You were trained 2 weeks ago. What do you mean? Oh, that training? Oh, okay. So there's still a lot because there's so much going on in the health centers, right? And the people are just busy or they're resisting, right? They're saying, nope, this is, if I just pretend it's not happening, it won't happen. So there's all of this support, but we still have have that patience to be able to say, yep, I'll show you again. But then there's got to be that balance to say, okay, Serene, we've shown you multiple times. We've shown you the resources where you can go. What's happening? Why aren't you capturing this? Let's look at a corrective action and what do we need to do? Because we have to hold our staff accountable to say, this is the culture of the organization and this is what's going to happen here. And we are going to work through this. So how do we make that happen for you so that people do move and cross the line into that change?
Yeah. All right. I'm not seeing any comments, so let me go ahead and move on here. All right, so we have two more areas that we're going to discuss, and we'll come back to Serene one more time. So the first one is monitoring and evaluation. So monitoring, monitoring obviously is trying to detect change as you go through the process. And so you have a variety of things that you have to look at and measure. You're looking for successes, you're looking for challenges, you're looking for bumps in the workflow, bumps in the road, and you're looking at staff behavior, attitudes, and organizational performance metrics. So we recommend that you add evaluating staff, and it sounds to me that is definitely happening at Finger Lakes, where you do some evaluation of staff experience as you go through your change process. And that begs a few questions. So some of those questions that you might ask yourself would be like, are you going to evaluate, do you need to evaluate staff readiness? Or, how are you going to know how well prepared they are for a change? Or you just have to plan, like when you're going to receive feedback for staff. Is it going to be at 1 month, 3 months, a year? Are you going to check to see how effective your trainings were? Are you going to work on your training ROI? Are you going to assess how staff really feeling about the change? And then what obviously with evaluation, it's around key performance indicators, what was directly changed by the project, because that's usually the purpose of a change project. So, and then the other area is workflow analysis and redesign. So changes to processes and workflows are a continuing and important part of health center change. So you definitely want to look at and plan your work in this area too, as one among the 6. And again, we received recommendations to work throughout the change process. So to be continually looking at your change workflows and see if that's going to work, or conduct pilots, things of that nature. You do have to be willing to readjust your plans and redesign. Sometimes that means a slowdown, but you may need to remove workflows that hinder success. But if you think about that change management definition, where the purpose is the success of the initiative, that also means stop, wait a minute, we need to go back and pause for a minute and figure this out. And health center boards and leadership can help with supporting this type of an attitude. Again, from from our health centers, you know, we received sort of the advice that, you know, if you take it small or take it a piece at a time, sometimes that, you know, work on a small project and kind of divide and conquer some big objectives that you have, that will work sometimes. We did find also in the research, we did find that if you plan to roll out new workflows early in your change process, you have a chance of, you know, hitting an early success. And that can when you share that with staff, sometimes that can help provide the momentum. Oh, hey, this is working. And we did hear from health centers that data, and they're constantly trying to figure out their access to data. And during COVID, there was, you know, it was like, oh, we're going to have to do this because we have to have data from every single site in order to make sure we can monitor something or figure out this workflow. So, you know, access to data is really an ongoing challenge and an ongoing change project for health centers. So Serene, we're on our final questions from you, and I would really I'd like for you to address. So in addition to the last two areas, workflows, evaluating change, you know, I'd like for you to, you know, give us some advice about managing change from Finger Lakes, and tell us about the types of activities around workforce resilience and supporting staff, which I think you've already done a little bit of.
Sure. So the big thing with evaluating change, right? The big part for us is making sure that it's not a distractor. There are a lot of things happening in healthcare. There's things that are always changing. There's a lot of initiatives that might be coming our way saying, hey, participate in this, or participate in that, and it's going to improve the different work that's being done. It does have to go back to our mission, our strategic planning to say, does this make sense? Does this little puzzle impact the bigger picture of the work that's being done? So that is very important for us to be aware of, right? So having those key objectives that we're trying to follow or improve on are important. So if it's clinical, what clinical benefits are we looking to increase or decrease with the change that gets done? So that may be building a registry. We're looking to increase access for our diabetics, or increase success Hep C turnout or whatnot, right? Depending as to whatever the project is, what are the expectations and what are the end goals that we want to achieve, and that becomes our data that we're looking for to look at. So we have gone as far as, for example, for Hep C, when we started looking at was it feasible to provide Hep C support, Hep C care through telehealth. We looked at what is the national statistics and standards of completion of getting people through their Hep C treatment and getting cured, and then what was the regional statistics, and then we based off of that and said, okay, well, this is what is going to be our goal. We want to be equal to or better. Our motto has always been equal to or better from the work that's been done in person, that to replicate via video conferencing through telehealth. Otherwise, it just becomes more work, and it becomes a distraction for the patients and for the staff. And we don't want to produce more work if it's not going to give better outcomes, or that work maybe then becomes more efficient and effective and reduces work in other areas. So finding what those metrics are is very important to be able to evaluate that change. And getting that feedback from our patients and our staff who are involved in the process is also helpful, because it changes and it adjusts the experience. So for example, for behavioral health, we did, when we first started doing behavioral health via telehealth, we sent out our surveys to the providers, the patients, the telepresenters, all folks involved, and we got great feedback on things that you wouldn't have thought of. One of them, for example, was from the provider saying that the equipment was too high, that they're having hard discussions, and the camera view is like is like the person is looking down at the patient, and the experience, the feeling of that wasn't fluid. So could we move the equipment at more eye level? Another patient said, oh, this was fine, right? But what's the point of doing it via video if I can do it over the phone? And we asked, what do you mean? Well, the patient was saying that they would get on the computer, but the screensaver was never turned off. And after a few minutes, the computer would go black. So they're just talking to a black computer. All of that information is key to have a successful program. And we wouldn't know that without having those surveys and asking the questions of how the experience went for folks. So it could be as simple as things like that, as technology being used, or the process, or their workflow, or even deeper processes as to were the provider and the patients on time, or different things that could really impact the workflow, right? So all of those little pieces, those little nuggets help to evaluate the workflow and the change, and then continue to have that buy-in from the staff and from the patients to make sure that things continue to move forward, and to say, yep, this is great. We have great outcomes, and it's something that we can replicate and put more energy or move to another site and expand the work that's being done. Or we need to go back to the drawing board and really evaluate, because it's not giving us the results that we wanted. For example, for our teledental program, we did all of our processes in place, but we weren't getting our kiddos to complete their dental care enough to really warrant the success of the program. So we went back and looked at, okay, what are our processes? What are we missing? We learned that what we were missing was the community health workers, the patient navigators, to help the families make sure that they're able to get to their appointments, be able to get to the places that needed to be. And it had nothing to do with the actual clinical workflow or the technology. It's just that we needed another puzzle piece to make the picture complete. And with that, we got our success rate to 90-some%. So little things like that really help build our change and really impact the care that we give to our patients. But having that evaluation and that process really work through, and ensuring that all the key players are at the table is important to make that change happen, and then sustaining it, right? So for us, for managing that change, we start at the beginning, from when we are interviewing folks to come into the organization, and tell them how we work at our organization. What's the culture of the health center and the expectation? And one of them is that we use a lot of video. So we start off by doing a video interview, and we send the folks the link, and we're able to see, okay, are they able to connect on their own? Are they going to be able to call and say, hey, can you help me get on? What's going on here? And just setting that tone, that expectation to say, this is how we do things here. Currently, we're in a process of revamping our in-person services for our patients, and we are discussing that when we onboard providers, when we onboard nursing or anybody, administrative staff. We say, this is the way that we provide services at our health centers, and the expectation is that people are going to buy in. And if it's not for them, okay, it's not for them. We'd rather know early on to say, you know what, I'm not too keen on being on a team that does this kind of work. Great, we know that from the get-go. Onboarding takes a lot of time and resources, so let us know that now, versus getting them in through the door and then setting the expectation. So we start off right from when the person gets interviewed and hired, and then during the onboarding process, we have a whole process in place to let staff know what are the different things that need to be trained on, and how they are able to use the different resources. So it's it's bigger than that project, right? It's a cultural change within the organization that it's expected for everybody to be able to do. in Finger Lakes. So it doesn't matter what position you hold, the expectation is that you are going to be able to maneuver through these different changes and be able to adjust to that.
Yeah.
Um,
So setting
but-
the expectation from the very beginning of the relationship with your
Mhm.
staff. Yeah.
Yeah.
One question that I have in terms of change management for you, Serena, is how do you guys communicate successes with your staff?
Yeah, so we have a monthly all staff meeting that we do via video. We have every business unit has a few minutes to be able to say what's going on. It's just like snippets of highlighting different things that are going on, right? So we highlight there if there's a success going on or just things that are coming. Then we have all emails, and the all emails can be written out. They can be with blogs to say just a quick video. When I'm trying to motivate staff, I'll do vlogs with avatars. So I've sent videos of myself to the staff looking like a giraffe or just something different, or having my emoji face on so that people can just look forward to, okay, what is she doing now? Like what's and really listening to the message that is coming on. And it's quick, right? It's only a few minutes because it doesn't, the bigger explanation really happens in the department meetings or the health center, the specific health center meetings that are taking place there. So there's those places. And then depending as to like, so right now we're doing an initiative in one particular health center. And we have this big board that says, these are how quickly we're getting patients in through our door and the success rate, so that we have a banner that in that health center that says, this is where we're at. And if we're looking at data from a variety of health centers, it goes as an email, whether it's an Excel document, a pie chart, or a graph, so that people are able to just quickly look and say, oh, this is where my team's at, or this is where the other team's at, or what's going on. So that's how we're able to give the message out as to how change is going, or whatever initiative is being placed.
All right. And any other advice before we close? Or
so what I actually wrote down here is to really, the big piece is to help folks feel that they can bring that change. Like when new staff come in, the conversation that I have with them is, the person's coming from a different environment or a different health center or different space, right? So they are looking at our processes through different eyes. So I'm always telling folks, if you have any feedback, if you have any thoughts, even though you've been here a day or 2 days, let us know, let me know, and say, hey, have you thought about this? Have you thought about that? Because a lot of times we've been doing something forever and we just don't see things with different eyes or see things through a different lens. So for me, that really sets the tone to say, here's a new employee and I'm asking them to give me feedback. I'm telling them to look at from their experiences, what they have seen out there, and they're looking at a process with a fresh pair of eyes. How can we make this better? Are things effectively working? Any thoughts or ideas, good or bad, let us know, because we want to know what's happening, right? So I'm always having a conversation with folks about that. And sometimes people are really quick to tell me information. Other times they're still very much like trying to get their bearings in place, and they'll come back and tell me some things later. And sometimes I don't hear anything at all, but at least it gives the folks that opportunity to know that they can give suggestions, that it's an open invitation to be able to improve our processes that we are providing to our patients and to our staff.
yeah. All right. So Serene, thank you so much. I learned so much today. I really appreciate you having you here and helping us with this topic. And if anyone has any questions for Serene or any comments to make, I hope I can see them in the chat. Please feel free to go ahead and put in your comment, and I'm going to go ahead and start us. We're at 2:41, so I'm going to go ahead and finish up. So I just want to remind you again of the 2 resources. The first one is Key Strategies for Effective Change Management in Health Centers. And then we have our resources for key strategies to help health centers protect against staff burnout. And of course, after this webinar, we will be sending you the PowerPoint, and you can get a link to the recording when it is uploaded. A couple of additional resources I wanted to make sure to share, because I know that we have migrant health centers available with us, and I know that you will have all kinds of new initiatives for making outreach to agricultural workers. So you'll need to understand how to identify and register your agricultural workers, and get some key tips on finding partners, working with partners, and starting outreach programs. So the Health Center Toolbox in the Farm Worker Outreach resources are just 2 links that are just a wealth of resources from NCFH in terms of those types of activities for you migrant health centers. And then I also included, since the communication topic was of such interest to the people that gave us feedback, I included a little article on communication during change management. And it looks like I have a question. So let me just make sure. Okay, so Jesse says, what percentage of Finger Lakes staff are bilingual, and how do you fulfill the need of interpretation, Spanish, English, and what system for interpretation do you use if using one?
Yeah, so we do have a third-party interpretation service that we use, and it could be done either via video or telephonically. And we also have interpreters at our organization. So we have a program, we have a person that's on our staff that does the certification for interpreter training with our staff, so that they get certified to be interpreters. And I want to say I actually just messaged our HR person to get the most up-to-date number, but I would say it's over half of our staff are bilingual, and they are in a variety of different levels, right? So we may have staff that are bilingual, but they are not certified interpreters. So they're able to have a conversation with a person, answer the phone, schedule their appointments, and do regular conversations that you would do with a person. But then we have higher training and testing for people that are going to be interpreters. And then for our providers, if they are bilingual, we have them do a testing as well to ensure that they can be with a patient and speak in the patient's native language. And so that goes with our compliance, right? If I'm a provider, I'm a clinician, and I'm saying that I speak French, I'll be tested with my French skills with an outside organization to ensure that my French skills are appropriate for me to have the clinical visit with the patient without a certified interpreter. Otherwise, we have an interpreter in the office. So we have our own staff that are interpreters, and then we have third-party interpretation services as well. So it could be American Sign Language or another language that could be done through our third-party interpretation. For us, our on-site interpreters, our staff interpreters are Spanish and Haitian Creole. We have, I think, 2 people that do Haitian Creole, and the rest are Spanish.
All right, and Leanne asked the question, what interpreter training certification do you use?
It is it's called Bridging the Gap service. So Bridging the Gap is the name of the program, and we had a person go out to be the trainer, and she holds it's actually Beverly Servant, Katie, who holds the training. So she's not teaching the language, she's teaching how to be an interpreter. And then Bridging the Gap has a test that they do, and they get a certification from that. So it's not the national certification, because there is a national certification that you're able to get. That's the next step that we encourage our interpreters to get. This is a certification that we do through Bridging the Gap.
Okay. And then Amy says, I want to thank Serene for her work. My parents are actually patients at Finger Lakes and are
Oh,
farm
great.
workers that migrate to Florida every year. It was wonderful knowing a great FQHC receives them there.
Well,
Thank
thank
you
you,
so
Amy.
much,
That's
Diane.
awesome.
That's wonderful. We appreciate you guys. All right, so I want to be respectful of everyone's time. So let's go ahead. Here's our contact info again. I'm Katie with NCFH and Serene Garcia is Chief Innovation Officer at Finger Lakes Community Health. We really enjoyed having you here and appreciate you being here. So many thanks one more time to Serene. And at this time, we're going to conclude the recorded part of our webinar, but I want you to please hold on because Sylvia will have a few additional resources and upcoming events to let you know about. And we also have a little evaluation that we want you to fill out. So take it away,